Hello subscribers, thank you very much for watching our earwax removal video today.
I was just going to say hello. How are we all doing?
So just in case you don't know who we are, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates, and the lovely gentleman to my left is...
Mr. Taylor Green.
There we go. Just all Taylor
Green on this one. Taylor Green.
So this is actually my patient. There's one of of Taylor's in this video. So you can see this first patient here, very, very sticky. So lots of dry pieces of wax. Now this patient was explaining everything. He was saying that he was coming in to get his wax removed, not so much for a hearing issue, but because he'd been experiencing some balance issues. And as audiologists, we've always got to do a bit of digging into the history of the patient. And it turned out this patient was only really experiencing certain issues with balance. They were getting when they were moving their head too quickly, if they were looking up, looking down, if they rolled over in bed one way but maybe not the other. Sorry, this is classic presentation of something called BPPV, which stands for benign paroxysmal positional vertigo.
It's a mouthful.
It is. Lots of people get this kind of issue, and it's due to little crystals that can become detached from one of the organs inside the balance system. If you get enough of them clustered together, it causes misinformation between your two sets of balance system organs, basically. One thinks you're moving much quicker than the other, and so you get the dizziness that comes from it.
Yep.
Very easily fixed though. You can have something called the Epley maneuver done. They position your head in different positions, and that actually sort of pops the crystals back where they should be and resets the balance system, for want of a better word, and that means you're going to hear a lot better. So we give them advice on that one.
Yeah, most people's sort of Epley maneuver is sort of fixed within one visit, but you know, some people may require more than one.
Yeah.
But yeah,
it's a very simple thing to fix, and I've had a string of people through recently. One person had it for 20 odd years, didn't realise you could have that done. I think this gent had this for about the last 2 years. I've had varying reports. Some people have had it for like 6 or 8 years, and you just explain that this is what happens. You do a little assessment first, just to assess what side is causing the issue, and then you crack on. You can get that done as well. Very dry skin now. You can see it was always going to be dry just because those pieces were much drier in there as well. I've popped a little bit of olive oil in. Just helps, I find, with the dry skin. Just to help to get it just to detach a little bit more easily. Yeah,
it peels away a little bit easier, doesn't it?
It does seem to come away.
The oil just like rolls with the peel, and
it does seem to work a lot better. So you can see here, we're just getting these last couple of pieces out. Don't forget, guys, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe for me. That saves me saying it at the end as well. Don't forget to hang around, because Taylor's video is coming up next, which is also a super soft and sticky earwax removal. 7/8 of an inch.
2.5 centimeters.
That's quite a bit. So they were quite chunky, dry pieces. I'm going to be quiet now and let Taylor do the rest of it.
So I've got kind of the opposite. I got like a super soft and sticky type of wax in this one. Patient has been using some oil, but you sometimes find when you can see the wax in this kind of consistency, it can potentially be naturally this soft and sticky, which, you know, is possible, but you can sometimes see it as well when you get patients that just use drops and drops and drops and drops, and they just use it for weeks, sometimes even months on end, without it going anywhere. And yeah, you can see we're kind of slowly sort of making a little tunnel through this wax at the moment. So I'm just going down the center, just seeing if there's any give. You can see the ear canal already at the bottom there. So it is, you know, it is at the start of a peel almost.
Sometimes you need that, don't you? Because when it's really soft like this and it's stuck to everything, we rely on natural sort of topography there of the ear canal, and we struggle a little bit if that's not there to see where we're going, how deep we are. Yeah. Always good to uncover.
Yeah, and what I'm just doing this kind of backwards, like kind of stroking motion here, this wax at the outer part. We can touch the ear canal in that sort of portion because it's just made of cartilage. It's just a really soft, flexible part of the ear, so you won't get any pain, discomfort, or anything touching that bit. Wouldn't be able to do it this far in the ear though, because we're literally just skin on bone in this portion, so it's a very, very sensitive area, this bit. I can see it's given us a little bit of trouble actually, and they always tend to give us trouble, to be honest, because again, you know, unless you can see parts of the ear canal underneath, you never quite know where the ear canal is. You always got to be really, really careful. You know, you've always got to take your time and, you know, not rush anything, because if you just went straight in, obviously, you know, you could end up causing a I don't know, a bruise or a
bleeding,
bleeding, yeah.
Damage to the ear canal or ear drum.
Yeah.
That's the problem with this sticky wax, is every ear canal's got this sort of elongated S shape to it, but you don't know how severe those bends are going to be in that S shape. So you can be ticking along quite nicely and straight and think, oh, I got to keep going, and then suddenly there'll be a dramatic change, and bump, you're at the side of the ear canal.
Yeah, and you know straight away when that happens.
Yeah, patients will pretty quickly tell you that that's happened as well.
Yeah, it's usually a case of they just goes, oh,
yeah,
and then that's it. But yeah, you can see we're starting to get a little bit of movement. So obviously all the oil the patient's been using has affected the sort of front half, the sort of first half of the ear canal really. We've got this slightly harder section which does seem to be moving in one piece.
It's almost like the front's been over softened, isn't it?
Yeah. But again, it's almost impossible for you to know there's no perfect amount of oil. Yeah. Because you just don't know what your earwax, unless you've got your own cameras and you know what you're seeing, you don't really know what it looks like and how hard or not.
It's tough, isn't it? It's really difficult to know kind of what what the consistency is, because that is purely down to genetics. No two people have exactly the same type of earwax. It's always subtle differences. So I had a lovely pediatric patient in today, and the one side was rock solid, the other side was like this, was really mushy, and that's a variation just from one particular patient's ear canal.
So yeah, we've pulled it forwards. We're literally right at the entrance of the ear now, but I'm just gently trying to hold the grip.
There we go.
There we are.
Nice.
It is going to be a little bit of a messy one, because there's going to be a bit of staining on the ear canal, which is absolutely fine. When you come for wax removal, the physician you see, or the audiologist, or the earwax practitioner that you see, is the aim is to get a view of the eardrum, clear the blockage. It's never going to be 100% spotless in there, so you will always get little tiny bits, but we try and clear as much as we can.
Why would you need to have some earwax in your ear canal to the green?
Because that keeps your ear, it's a protection really for things like dust and dirt and bugs. It stops them from getting inside. The wax is slightly acidic, so it actually helps to fight off infection as well. So we do need it in there, and even if we take it away, the glands inside the ear will start producing that wax pretty quickly. But considering how this was looking to start with, I'm pretty happy with the outcome on this one, to be honest.
It's looking good.
I said, luckily that wax that was deeper, sort of up against the eardrum or close to the eardrum, it wasn't quite stuck to it, because you normally see all that wet kind of sticky wax right over the front of the eardrum. It's a bit of a nightmare. So we've obviously struggled to get that last little bit there. But we always advise the patient use a little bit of olive oil. Even if there's tiny little bits there, that should start migrating out naturally and quite nicely.
So we've got 1/2 inch there.
1.5 centimeters.
Well guys, thank you very much for watching our video again today. If you do enjoy the video, I've done that already, don't need to do that one. But as always guys, take care of yourselves.
Take care of your ears.
And take care of, I will try and make less mistakes at the end of the videos every time now. And take care of one another as well, please. And we shall see you again for the next video. Bye everybody.
Bye.